Hello and welcome ImageTrend Elite EMS users. My name is Tom Green and I'm a strategic advisor here at ImageTrend. I'm also a retired Deputy Chief of Operations for the City of Virginia Beach Department of EMS. Today we're going to take a little bit deeper dive into patient timeline under the repeat patient functionality within Elite. The repeat patient functionality and the timeline are available both in the offline or Elite field version as well as the web version we're seeing here. So as we're dealing with our high utilizing patient population, some of which have underlying chronic illnesses, a good tool to use is to have historical data in graph format for our providers to be able to judge what normal baseline is compared to any deviations, thereby helping us to direct our treatment modality. So once we pull in the repeat patient information from Ms. Davis here and it drops in all of her prior medical history, allergies, and so forth, one of the things we can do under the timeline function here on the right side, once we click that timeline, it is going to give our providers quick access to items such as dispatch reason or provider impression or primary symptom. Since Ms. Davis is calling for chest pain today, it's important for us to have a historical look back to find baseline for Ms. Davis. So as we click on things like blood pressure, it's going to chart all those encounters in her prior PCRs and bring those back to the provider in real time. Since she's calling for chest pain today, it would be very helpful to me to figure out what her baseline 12 lead EKG is. By simply clicking medical device, we can see that all of her prior attachments to an EKG monitor imported into Elite for prior encounters is displayed for the provider. This helps the provider make informed decisions on what may be baseline for Ms. Davis and what may deviate. For example, I can look at prior 12 leads that were captured in Elite by a provider that encountered this patient before and pull those up. By doing that, I can compare it to the current tracing that I'm looking at patient bedside. If I want to get further details into more historical data, I can always compare even earlier 12 leads, such as this one. This gives the providers a tremendous tool to be able to see what this patient encounter looks like compared to her normal baseline or other encounters the EMS agency has encountered with Ms. Davis. For any questions pertaining to repeat patient and the patient timeline, please contact your representative at ImageTrend.